My name is Jasmine Locklear. I'm 26 years old and I am 39 weeks pregnant. Because you see that part is going to be the top, yeah, that's the bottom.
You don't like gray?
I do.
Okay.
It's big.
It is supposed to be big, so it can hold Junior up.
It still don't feel real. I said, I guess it won't happen and really kick in until he's here. Well, I can only imagine, him being here. And I said, I want to kiss his face and pinch his cheeks because I got a 4D sonogram done a couple of weeks ago for the baby shower. And the lady who did the sonogram, she was just like, oh, yeah, he's kind of chunky, Still in there roasting. They said he was at that time about 6 pounds and 13, or was it 13 or 15, babe? 15 ounces. We all set. Let's get at the edge. United Medical is actually in Washington, D.C. as well. So that's a little closer than GW. And I was going to go there because I heard that they had the #1 maternity ward in DC. So I was actually going to give birth there, but I think they had an experience the way as though they had to shut down their maternity ward.
Let's see, we're gonna need 3 for each side. 3 times 4 is what?
3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
So 3 times 4 is what?
12.
Exactly, there we go.
In 2017, 2 maternity wards closed down in Washington, D.C. Jasmine Locklear lives near one of them, United Medical Center. It shut down after multiple medical errors. So Jasmine now plans to give birth at George Washington University, or GW, about twice as far away. And with heavy traffic between Maryland and Washington, D.C., the drive could take up to an hour or longer on public transportation. With no maternity ward nearby, Jasmine is just one of the millions of women living with limited access to maternal care.
I feel like with these 2 maternity wards shutting down, it makes things a little more hectic on the hospitals that are open with maternity wards. From my experience, like I said, I had to switch my insurance over to GW. I had to go through a long process with even getting an appointment just to see, a doctor with confirming my pregnancy. I know people have to travel further, which is more expensive for patients. People have to wait longer, to see a doctor or get a, doctor's appointment. So it definitely has some negative effects. But if they shut down, obviously it's for the, the better. Something wasn't going right. Why risk having our patients, or our community go to these maternity wards and, risk having something happen to their child or even them?
To get a more detailed picture of maternity deserts at a national level, Newsy's reporting found that 10.6 million women live in counties with no OBGYNs. We also looked at one of the states at the heart of the maternity desert crisis, Missouri. We estimate that more than 75,000 women in the state have to drive more than an hour to reach a Missouri-licensed obstetrician practicing in the state. And as populations decline across rural America, a lot of hospitals have closed, leaving behind many women in need of care.
I grew up here in Kennett. It's really, to me, it's like a retirement town because as far as like coming here to raise your kids, it's kind of small. There's not much to do for them, so. My name is Keela Abernathy. I'm 21 and I'm the mother of 3 children. I found out in 2017, December, that I was pregnant. I was prepared, to have my baby there with the same doctor and the same OB support staff that they had, with the doctor that knew my body, and knew a little bit about my pregnancy because that's who I'd been seeing the whole time I was pregnant. And I didn't get that. I just got a letter one day like, we're leaving. I had recently had a miscarriage, so with me getting pregnant 5 months later and it being twins, I was high risk. That day, I just woke up, I was having an ordinary day. The hospital closed at 12 that night. Fine, I didn't think nothing of it, you know. I still had a few months left in my pregnancy before I gave birth. And at about 4 o'clock that morning, my back was hurting really bad and I woke up with my doctor being in Cape Girardeau, which is like an hour and 15 minutes. We didn't want to just hop in the car and get on the interstate without knowing, you know, how far along was I dilated. So my mom, she got me in the car and we went to Hayti, and they have no OB ward at all. So I rode by ambulance to Cape. When I got to Cape, I was already dilated to a 9. They rushed me to emergency C-section. She delivered them and they took them straight to the NICU. And then when I woke up, I had to wait for like hours before I got to see them. So I just gave birth to 2 babies. I don't know what they look like. I don't know how their health is. So I was an emotional wreck at first. But finally when I got to see them, like I just felt so relieved.
Ah, man. What? You want me to teach you?
He's twin A. He's the first one. He was born first and they're a minute apart. He was 3 pounds and 3 ounces. This was their oxygen tubes. When they were first born, they had to be on oxygen. And this is their blood pressure cuff. So that just shows how little her foot was. This is just like, it's a box that I keep all the memories in from like when they was in the hospital and when they was first born and stuff like that. And I keep it put up. I kept like a couple of their preemie outfits. There's a place where a group of ladies, they make little hats and send them to the NICU for free. And then the hospital, they give them out to the babies. So they have a lot of them because they were there for 2 months. But I just thought it was just neat, so I kept all of them. I was supposed to be off work for 8 weeks, but I couldn't wait 8 weeks. Like, I know my body needed it to recover, but I just couldn't do it. So I went back to work 3 weeks later after the C-section. We still have to travel back and forth to Cape every 3 months, so that kind of gets exhausting, but they have a pediatrician here as well, so it's going good. What's wrong, man? What's the matter? Now that the hospital is gone, like, it was a good hospital. Like, I wish it was still here because, like, now we have nowhere to go, you know? Everyone needs a hospital. Emergencies happen 24/7.
So we did research looking at all of the rural counties in the United States, and we looked at the loss of hospital-based obstetric services. So when hospitals either close entirely or when they close their maternity wards. And we found that between 2004 and 2014, 179 rural counties lost hospital-based obstetric services. That's 9% of all rural counties. And by the end of that time period, in 2014, more than half of all rural counties in the United States had no place where you could give birth. There was no hospital that provided obstetric or maternity care services in those counties.
Currently, there's no data tracking maternity ward closures nationally, so there's a lot to learn about why they shut down. In each state we focused on in this report, and in Washington, D.C., we asked hospital administrators if they would speak to us about the trends in closures, but none of them agreed to an interview. So to get a full sense of why hospitals closed their birth centers and maternity wards, Newsy searched through trade publications and news articles to assemble a database of 119 closures across the country since 2008. What we found was a long list of reasons cited by hospitals. At the top, 36% of the hospitals cited declining birth rates, low demand, or both. Below that, 20% of hospitals cited financial issues, and 14% said low reimbursement for Medicaid payments. But experts say the driving factors behind many maternity deserts go far beyond the choices hospitals and their administrators make.
The data are really clear about who suffers the worst maternal health outcomes in the United States, and that tends to be Black and Native families, as well as rural families. We also found that counties with a higher proportion of Black residents, where there were more Black folks living in these rural communities, they were more likely to lose hospital-based obstetric services, even after we controlled for everything else. Race alone was a factor. Black infants are twice as likely to die in their first year of life as white infants. And Black moms are 3 to 4 times as likely to die in childbirth. That statistic, that disparity, has not budged in almost a century. Those disparities persist, and they persist because the root is structural racism. It's structurally how resources and opportunities are allocated based on race. And it's broader than any doctor-patient relationship. It is broader than any hospital protocol or decision. It is broader than any one community. Housing and education and employment to healthcare access. That history is part of what continues to perpetuate the horrifying racial inequities in all aspects of health, and in particular in maternal and infant health.
These closures have left medical professionals often caring for patients who travel a long way for care.
Albany is rural, also is located southwest Georgia, about 3.5 to 4 hours from Atlanta Airport. You have one of the major hospitals, Phoebe Putnam Memorial Hospital, here in town. My name is Elois Edge. I'm a certified nurse midwife here in Albany, Georgia. Midwife means with woman, so we take time, teach more of a personable touch. Particular state of Georgia, a lot of the hospitals did not get the resources from Medicaid or from the state that they need to stay open. Coming in. You got any questions for me while I pull up your chart? The baby heart tone gonna range between 120 and 160. And you want a strong, steady beat. All right, girl? Sounds great. Okay. All right. Any other questions running through your head? All right. This is my pro here. There are many patients that's not able to make it to the appointment, and you have a variety of reasons. Some transportation, some just that high-risk population, maybe not doing well at times. So many different rural areas, so many hospitals are closing or have closed over the years, and so those find themselves having to find somewhere to come, and oftentimes it's our clinic. When I talk about midwifery, you're talking about the heart, because you're not gonna be a millionaire. You're there to serve. So a lot of the OB, the labor and delivery units, were not revenue gaining for hospitals, and therefore they weren't able to sustain care.
You know, you generalize a person because you don't understand their body language, you don't understand their vernacular, the way they speak.
Yeah, I'm tired. Me too. I wonder how long the belly cast will take.
You know, it's automatically assumed that Black women have these attitudes and that we're just loud and we're not hearing anything, or that we're making up our pain, that we're not being, that if we're saying we're in pain and we're hurting, that we're just complaining or just being loud, you know. It's just not the truth. If I'm in pain, I need it to be heard and valued the same way someone else says that they are too. I need you to come to my aid and help me.
Hi guys. Hello, hello, hello. This is my doula, Dion. These are my siblings.
My name is Dion McDonald and I'm a perinatal community health worker, AKA doula. So a doula is a person who provides information, education, physical support, spiritual support if necessary for a mother while she's pregnant, for her labor support and postpartum support.
When it's an option, working with doulas and other support workers at home during pregnancy is one way mothers can help counter the impact of losing medical care nearby. And for Jasmine Locklear, it gives help handling stress, which a growing field of research shows can have real effects on the physical health of a pregnancy.
That looks like a perfect little belly. It does. Look how big your belly is.
There are specific geographic regions within the district that are facing higher maternal mortality rates and higher rates of complication during pregnancy. So for example, women in wards 7 and 8 represent a high proportion of women who suffer from maternal mortality or complications during childbirth. These women also have limited access to health care. One thing to note about these closures is that the maternity ward in the United Medical Center that closed was the only maternity ward in the district that was within a public hospital. So women who may not have private insurance or may not have the means to self-pay for their health care are now facing a decision of where they should receive their care. This leads to women with limited incomes and limited support. I think we often think of health as a result of decisions that we make, like do we smoke or not, and do we eat nutritious foods or not. And while that is one part of the drivers behind health, another part is just our everyday lived experiences. Do we receive stress from people because we're being discriminated against based on the color of our skin or our perceived income levels? All of that translates into health that is shown both physically and mentally. And I think that we need to consider a more holistic definition of what it means to be healthy.
Despite living in an area that lost care, Jasmine says she felt supported and listened to by the medical staff where she did find care. She says that and finding support close to home were big reasons why she said she had a positive experience giving birth.
Hey, Junie.
I think it's important for Black doulas to be there because we can relate already. We are in the neighborhoods that have the least access to fresh food, to mental health resources. You know, we go into the homes. There's that cultural competency. Like, I understand why some things are the way they are, and I just want to be there, and you know, I can do that.
Ooh, big yawn, Stinky. Big yawn. Them fingers surely are good, huh, little man? Are the fingers good? Come on, you want to eat? You want to eat? You're so sweet. How are you?
Hi, mommy.
How are you? Good. Amazing.
Hi, handsome.
Can you say hello?
Oh my goodness.
My sleep pattern is off, of course.
Of course.
Yeah, but
yeah.
all of the negative things go out the window when, you know, dealing with him.
He looks good. Do you feel like you were being supported by the nurses and staff and her?
Yes, absolutely.
Yeah.
Like
the
I
midwives
didn't. I did. So the nurses and my midwife was amazing. I got there. They gave me exactly what I wanted. Like I complied. Of course, they had to get the IV in me. And after that, once they were finished doing what they doing, I just asked, like, can I just stand up and, you know, get and go through this? Because laying down on a bed, it didn't help for me the whole time. Even when I was home, I didn't want to lay in my own bed. So I appreciated the fact that she listened to what, you know, I felt would have been best for me. And she definitely was a great support.
I think our mothers need to really be heard in what's happening in their lives. I think we definitely need more. We need more birth centers. We need more birth-friendly spaces. We need adequate care, like not just this surface level care, but people who do go into the home and meet the mothers there. Do you feel like at any point you had any fear or?
No, not once did fear go through my mind. I was just focused on when they told me that everything was fine with him. I was just like, okay. I never once had any fear of my own, like I'm scared of this.
Yeah.
I was amazed at what my body really did, you know. I delivered a whole baby. Like I said, the way that I planned on it, no medicine, labored at home for majority of the time and went there and had him. The best thing I could have done. I felt like Superwoman. I'm just like, I really did that.